Hello, my name is Anthea Gibson. I am a student at Aspen University, enrolled in Community Health Nursing 2. Today we will discuss the core determinants of health and their impact on African Americans engaged in illegal drug abuse. Our objectives are to discuss and briefly review all of the health determinants of all populations, the effect on the various population, and also the impact on the targeted group, which is African Americans, and explain how the health determinant affects the targeted group. The core determinants of health and how they impact the population are listed to the right, as you can see in this chart: economic stability, neighborhood and built environment, health and health care, education, and social and community contexts. Policies can affect various populations differently, which lead to inequality, and some can help regulate certain problems. For example, policies that protect and minimize the access of illegal drugs. Income and social status. Financial status can lead to limited access to healthcare resources because of the high cost of healthcare services. Also, core determinants is education and literacy. Access to education can lead to better, healthier behaviors. This leads to less development of various diseases. The core determinants of health and how they impact the population. Biology and genetics is amongst the core health determinants. Genetic factors can cause the development of various diseases such as cancer. To the right, we have another graph: environment 5%, patient choice 40%, genetics 30%, medical care 10%, and social 15%. Another core determinant is health services. Limited access to health service can be caused by high cost of health care services, lack of availability, limited language access, and lack of insurance coverage. Amongst America, one of the major things in addition to mental health is access to care. Various factors may cause one not to have direct access to care, whether it be their social, like we stated, their finances, or patient choices. For example, personal health practice or individual behavior as core determinants of health. Personal decisions and behavior affect their health. Core determinants of health that impact the African American: substance abuse, income and social status. Core health determinants. According to various research studies, people with stable income are less likely to abuse illegal drugs. Lower income is also associated with drug addiction. Education and literacy, a core health determinant affecting the target population. Lower education and level literacy on substance abuse increases the risk for substance abuse. Individual behavior is a core health determinant affecting this group. Poor individuals' behavior of abusing drugs lead to development of other diseases, such as depression and anxiety. Abuse of drugs increase the risk for infection or sexually transmitted diseases. The other core health determinants affecting the group health services. The high cost of healthcare services is one of the issues that lead to the increased effects of substance abuse. Access of healthcare services is also affected by cost of transportation. The physical health determinants, such as recreational settings, also lead to people to abuse drugs. Recreation settings includes access to illegal drugs for African Americans. The local, state, and federal policy is another core determinant that affects the targeted group. Lack of policies that prevent interventions can lead to increasing abuse of drugs for minority ethnic groups such as African Americans. Thank you. This is the end of my presentation. Thank you for watching.